Good morning, ma'am. Ma'am is there. Madam is there. Ma'am, can you hear me? Hello? Hello, ma'am.
Hello, sir. Good morning.
Good morning, ma'am. Can you hear me, ma'am?
Yeah, yes, sir. Yes, sir. Yes, sir.
Okay, ma'am.
You're audible.
Okay, ma'am. Ma'am, if you can test your video on, ma'am, and another few minutes we will start, madam. Just
Okay,
which
sir.
is you can test your slides and other things. Okay.
Okay, sir. Now I'll do it.
Okay.
Sir, is it visible?
Yes, madam. Perfect.
Okay. Visible, right?
Yes, ma'am.
Okay.
Just wait for a
I'm
few more
audible.
minutes, madam.
No problem, sir. I'm audible, right?
Loud
Sir?
and clear, madam. Very loud and clear. You're clear, ma'am.
Thank you, sir. Thank you. Thank you.
Ma'am, we can start.
Okay, sir.
I will just give the introduction, then we will start immediately.
Okay, sir. Okay, sir.
Good morning to one and all present here. Welcome to the fifth day on the 5-day faculty program on 3D on 3D printing and techniques. Today, we have in our midst Dr. Renuka Devi, periodontist. Madam's remarkable journey in the field of dentistry is a testament to her unwavering dedication and exceptional expertise. She did her bachelor's degree in dental surgery from Meenakshi Ammal Dental College and Hospital and master specialization in periodontology from SRM Kantakalodur Dental College and Hospital. Dr. Renuka Devi has traversed the realms of academia and clinical practice with unparalleled finesse. Throughout her career, illustrious career, Dr. Renuka Devi has significant contributions in the field of dental healthcare. And also, she has been very much active in her academic research field, especially in the field of periodontics, and several publications in various reputed journals such as E-Midas Journal, and especially she has been noted for her work on pouch and tunnel technique for root coverage using connective tissue graft, which has been widespread, has been highly been acclaimed and recognized. And also from the academic career, she has also exemplified excellence in the field of clinical practice. Her expertise over a wide spectrum of dental procedures, including flap surgeries, implants, and connective tissue grafts, she has established herself as a leading authority in this particular field. And her commitment to patient care and clinical excellence has earned her trust and admiration of colleagues and patients alike. Her journey epitomizes the values of dedication, perseverance, and professional excellence. So, ma'am will be giving a presentation on manufacturing techniques for advanced composites for bone scaffold and medical implants. Ma'am, the session is all yours.
Thanks for your kind introduction, sir. Thank you. I'm Dr. Renuka Devi. I'm a consultant periodontist. Am I audible, sir? Am I audible, sir? Am I
You can
audible?
yes, ma'am. Yes, ma'am. You can slightly raise your voice, ma'am. That will be okay.
Okay. Good morning to one and all present here. I'm Dr. Renuka Devi. I'm a consultant periodontist. Today we are going to see manufacturing techniques for advanced composites for bone scaffold and medical implants. Usually, dentistry means they'll think is a single branch. In that, there is 9 branches. We'll see in detail. First, conservative dentistry and endodontics. Before moving into the branch, I want to tell you about dental anatomy. Now you see there is a tooth. In this tooth, there are 3 layers. The outer layer is the enamel, which is strongest. The second layer is the dentine. And the third layer is the pulp where the nerve and blood supply connects. Okay. If the dental caries comes in enamel and dentin, usually they'll do restoration like this. If dental caries involves the pulp, then we can't do normal restoration. We have to do the extensive root canal therapy like this. Okay. Next department is prosthodontics, where they'll deal with the completely edentulous or partially edentulous. What does mean partially edentulous or complete edentulous means? Partially missing teeth or completely there is no teeth in the mouth. Okay, they'll do replacement of missing teeth. Next is periodontics. That is my department. They'll deal with they'll treat the gum diseases and bone as well as cementum, everything, and they'll do implants and surgeries as well. Next, orthodontics. Everybody knows about this department. If I'm not wrong, they'll say like clip department. They'll do the alignment of the mal-aligned teeth. Next is periodontist. This department, they'll start the treatment from 0 to 17. They'll do all sort of procedures, all treatment they'll do from 0 to 17. Next is oral medicine. It's an important field. Usually they'll do diagnosis. You might think, why diagnosis is important? In tricky cases it's important actually, because if we diagnose only we can treat. In cancer patient, in immune mediated diseases, in syndrome patients, in those patients diagnosis is very important, because if diagnosed early as well as correctly, we can treat the patient properly. Okay, so in college setup, usually if you go to college, usually this oral medicine people will examine you first. They will diagnose and then they'll send you to other department. Next is oral pathology. This department also help in diagnosis, but this is different. Like they'll have a lab. They'll do cell study. If there is any lesion or cancer or immune mediated disease or anything, if there is any lesion, we'll take a smear study. We'll send it to the lab. They'll study the smear study, and they'll cell study, and then they will do the diagnosis, and they will send the impression to us. With the help of impression, we'll come to the conclusion like diagnosis, then treat the patient. Okay. Next is public health dentistry. What is public health dentistry means? Like they'll do all sort of procedures in a public. Like they'll take a mobile dental van like this and do dental procedures in a public. Like they'll do screening camps, they'll do treatment camps, and they'll do awareness programs to the public. Okay. Next is oral and maxillofacial surgery. uh, I think so. This is a very important branch, because nowadays RTA is more, like road traffic accidents are more. If there is any road traffic accident, like in head injury or face, then we have to meet these people. These people only help us. Uh, Next, like if there is any third molar tooth problem, these people definitely help us to remove that. Now moving on to today's topic, 3D printing. Uh, Now we'll see the bit of history. First, the motion picture came in 1888. In that only the motion picture was there. There is no sound, anything. In 1931, Kalidas, a picture came with sound. That is the first sound picture in southern film industry. Then 2D Mickey Mouse came in 1974, in 3D in 2006, and 7D picture came in 2014. Uh, but in applications, what we see is 3D, 4D, now maybe a 5D, but still no 7D. But it pictures came, but application oriented, we didn't receive. Next, I just want to thank first Dr. Charles Hull. Because of him only I'm over here. He's an American engineer, developed the world first working 3D printer. I just want to show you a graph. The graph raises when the year rises, because in dentistry the number of publications are more when the year rises, in dentistry as well as in 3D printing. Okay, mainly in oral and surgery the 3D printing papers are more. Now we'll see the various manufacturing techniques. What are the methods are like stereolithography, fused deposition modeling, selective laser sintering, photopolymer jetting, powder binder printer, then bioprinting. In stereolithography, they uses UV laser beam to solidify the resin. In fused deposition modeling, they're using the thermoplastic materials, and they'll extrude the material in a nozzle. In selective laser sintering, they're using the 160 degree to 200 degree Celsius. Usually what we use in dentistry is DMLS, that is a digital selective laser technique. In that 1510 degrees Celsius to 1600 degrees Celsius we use uh, to use titanium and cobalt, that metal, to solidify that and use. Those DMLS crowns are really good and fit, and really worth for um, everything. Photopolymer jetting, then powder binder printer. In bioprinting, we use cell loaded gels, and chiasan and ketosan and all those kind of things we are using in bioprinting. Now we'll see the thing in a flow chart. If the patient comes, we'll take MRI, CT, then we'll take the file saved as DICOM format, then we'll use the CAT software, then the file is converted to STL file, then we'll get a virtual prototype model, then we have to decide what technique we have to use to get a final product. Like we can use stereolithography or FDM, like fused deposition modeling, or bioprinting. We have to choose what technique we want. Then we'll get a printing layer by layer to achieve the final structure. Then post production modification. Post production modification is important in dentistry. Why I'm saying this? Already I told you, like DMLS crown. These crowns, no, if we are doing like ceramic or zircon, all those kind of crowns, post production modification is important, because this sintering enhances the mechanical strength of the ground. Okay. Next, this picture shows you the overall how 3D printing applies in dentistry. It's like in ortho, they'll measure the tooth using the scan. Using the 3D thing, they can study the root canal morphology, so that they won't miss out the any accessory canals to fill it. In perio, they'll study the defect, and they can do the regeneration thing. And in oral and maxillofacial surgery, it's what all needed is, first is planning for surgery, that is like surgical guide or drilling guide, all those kind of things they'll use. In prosto, whatever it is, we are like they want to replace, they'll use 3D printing. Next, we'll see a different type of materials with its advantages and disadvantages. We can classify the material into degradable material and non-degradable material. In degradable, again natural, synthetic. In non-degradable also natural, synthetic. In natural, we can see like chitosan, collagen, alginate. In synthetic, PLGE, PCl. Again in metals like titanium. Again in synthetic, again polymethacrylate, ceramic. The first we'll see the advantages. Advantages like high biocompatibility. The disadvantage is lack of mechanical strength. That is a problem. If you take titanium, uh, the advantages are more. The disadvantages like release of trace material over time, immunological response in some patients, uh, and mechanical irritation from underlying fixation devices, and it results in infection. So we have to use other metal for those patients. In if you are using synthetic PLGA, osteoconductive property is good. The problem is it create a strong acidic environment. Because of this strong acidic environment, cells won't grow. If cells won't grow, the treatment is a failure. Okay. And polymethacrylate, again, it's a problem is highly exothermic polymerization will happen. Because of this heat, again these cells won't grow, and it's prone to infection and lacks osseointegration. That is a problem. If we take ceramic, good osteoconductivity is there, but brittleness is the biggest problem. Next, in this we see what are the materials used for which application, we'll see. Okay. If you are using fused deposition modeling technique, we'll use thermoplastic polymers such as like PLA or polyether ether ketone for producing models. We can teach students, or we can health educate patients. For that we can use, or we can use low cost prototyping of simple anatomical parts. Stereo, if you're using stereolithography, we'll use variety of resins of photopolymerization like ceramic filled resins, etc. And the application is like we can produce dental models, surgical guides, uh, and splints, orthodontic devices like aligners, retainers, castable crowns and bridges. Aligners, I'll show separate picture and tell you. In selective laser sintering technique, we'll use alumide, polyamide, glass particle filled polyamide, rubber like polyurethane, etc. To manufacture the metal crown copings and metal or resin partial denture framework. This is for the missing tooth people will use. Okay. Polyjet printing will use a variety of polymers, and for manufacturing the craniomaxillofacial implant and sophisticated anatomical models, drilling and cutting guides, facial processes. In bioprinter, we'll use cell-loaded gels, inks based on collagen, photopolymer resin, alginate, chitosan, everything we'll use. This cell-laden scaffolds for hard and soft tissue printing we'll use. Next, I just want to show you this picture to show there are three type of manufacturing techniques: formative manufacturing technique, additive manufacturing technique, subtractive manufacturing technique. The formative manufacturing technique we use for conventional methods. Additive manufacturing technique, that is a 3D manufacturing technique what we are using. Subtractive also we are using, but we have to again mill it. Okay, after 3D scanning we have to mill it, but additive manufacturing, the milling it's not needed. Moving on to the next branch, that is prosthodontics. I already told you, they'll replace the missing tooth. Okay. Formative manufacturing, I told you, no, that is conventional denture processing is a formative manufacturing. Subtractive manufacturing, it's like we'll scan, we'll mill, and then we'll get the product. Like additive manufacturing will scan, 3D printer, and we'll get the processes. There is no milling needed. Okay, in additive manufacturing. I told you already, DMLS crowns are day to day we are using, and it was developed by German company US. And this in DMLS you usually use 1510 degree to 1600 degrees Celsius, and various metal like stainless steel, titanium, chrome, cobalt use this. But in SLS we use the lesser degree Celsius, so we use polyamide. But we use DMLS only day to day, and it's the fit is really good. I just want to show you this picture. In this picture, see, this central incisor is crown prepped, this premolar is crown prepped, and this premolar is crown prepped, and this molar is also crown prepped. Why I want to show you this? If I get this model properly, we can make a crown properly. If this edges, no, if this finish line will say, this finish line under, if it comes properly, we can make a crown. The fit will be good. So this 3D printing material is really helpful for the lab people. Next, we move on to the important department, that is oral and maxillofacial surgery. In this, the 3D printed objects are classified into 5 categories, like anatomic models, surgical guides, occlusal spins, like osteosynthesis plates, and facial epitasis. Anatomic models means those models we can teach students as well as teach, health educate patients. Surgical guide means like if you're cutting any bone or anything, uh, for that cutting guide will be used. Drilling and positioning guide. If you are placing any implant, those drilling and positioning guide will be used, because how much depth you have to go, what angle you have to place, all those guides will help you. Occlusal splints in TMG disorders will use. Osteosynthesis plates means if there is any fracture case comes, if there is any fracture, if you want to reunite those fractures, this osteosynthesis plate will use. Okay, facial epitasis means if there is any missing part of the face, if there is any missing in left side, okay, we'll use the right side as the mirror and we make it on the left side. That is facial epitasis. This picture shows you the CT scan of the lower jaw, that is lower mandible, which is completely dentulous. There is no teeth in the jaw. Okay, and virtual placement of the implant, and virtually they have done the surgical guide. Okay, this is after doing the surgical guide. It's a surgical guide. With use of this surgical guide, they have placed the implants in the mouth. Okay, what is the advantage of this surgical guide means the cutting the time, surgical time. If you know precisely how much depth you have to go, what angle you have to place, if you are good in it, you can do surgery in lesser time. So lesser time means good for patient as well as doctor, because doctor can see a number of patients more, and for patient the trauma is less. Next, this picture I want to show you, like again it's a 3D picture. Why I want to show is this yellow line, no, it's a nerve actually. From the inframandibular canal, the mental nerve is emerging over here. Virtually we are placing the implant. So we are checking after placing the implant, what is the distance between the nerve and the implant. If the bone is less, if the implant is impinging the nerve, we can pre-plan before itself and we can place according to that. Okay, we can avoid all these kind of trauma to the patient before itself. If we can plan, like the depth of the implant should be less if the nerve is close, we can improve the width, we can lesser the depth, all these kind of things we can do for the implant. Next, again virtually place the implant. This is with the surgical guide after placing the implant in a CT scan. This is like entire the entire mandible is they are reconstructing with the thing. Entire mandible they are reconstructing. The lower jaw. This partially they are reconstructing. Partially this missing because of RTA. So they are partially recreating the temporomandibular joint. Partially they are placing with the osteosynthesis plate. I want to thank Dr. Suresh Veeramani for this picture, for sharing this. This surgery is done in was done in Sims Hospital. RTA patient. Uh, this zygoma was missing, a zygoma bone that we call it as. This place was zygoma bone that is missing because of RTA. That is replaced with the osteosynthesis plate. This patient is doing good, eating well and doing good. Moving on to the next branch, orthodontics. Usually in this department only, nowadays day to day they are using 3D, like in Chennai, like high, if you go to higher end clinics, you will definitely see all these kind of things, like they will take 3D face scans. They'll show before treatment how you are, in middle of the treatment how you will be, in 80 percentage of the treatment how you will be, after 100 percentage how you will be. You want to complete in 90 percentage, you will be like this. After 100 percentage you will be like this. They'll show everything and then they'll convince the patient. This is very helpful for us to convince the patient how they will look. If they are not convincing with the outcome, we can stop before itself. No, that is good for patient as well as the doctor. Okay, so we can show the patient and convince. And we can make aligners. This is aligner. Okay, they're using with 3D printing. This aligner, no, it has advantage as well as disadvantage. Advantage is like the chair side appointment time is lesser for patient as well as the doctor. The cost is more, that is a disadvantage. And we can't do massive correction with this. We can do simple corrections. But the main advantage is, if the patient is wearing with this and doing the treatment, the other person won't be knowing because it is transparent. The person won't be knowing he is under treatment. Okay, that is the biggest advantage of this. Then in splint therapy, they are using 3D printing and for TMJ disorders, because splint, if you are using in laboratory work, no, it requires like major manual things, and it results in manual errors also. We can reduce all those kind of things. This is clip, usually we'll say braces in our terms. This is stainless steel wire and star like things, no, we call it as brackets. Okay, these brackets we can customize with 3D printing. Okay, uh, you might thinking like why we have to customize this, because each patient is different. In each patient, each tooth size shape is different. If we can customize each bracket, uh, the treatment outcome will be soon. If the treatment outcome will be soon, we can save time both for patient as well as doctor. So the patient will be happy, no, if the treatment is before we are ending. In that way, it is really good. And we can do mouth guards, retainers, expanders, these kind of things we can do. Next, coming into our department, that is periodontics. We are using 3D printed guides for aesthetic gingival corrections. This picture shows you this before surgery. We call it as gummy smile. Why it is gummy smile? If she smiles, the gums seen more. Okay, comparatively. So the patient complains of my gums are more seen. I don't want that. Could you help me? Yes, we can. So we are doing a surgery. For this surgery, surgical guide is important for me. That surgical guide we did it with 3D printing, so that we can note where we have to do the surgery, and we can do everything precise. We can pre-plan and we can do it so that the surgical time will be less. After surgery, the patient smile is like normal. Okay, it's not a gummy smile, it's a normal smile. She's happy, doctor is happy. Next, 3D printing we want to use in regeneration of the defect, but it's not actually successful, because cell growing is a biggest toughest problem. I mean, we can't do cell grow because of the acidic environment. That is the problem. How we will do? Like we have to scan the defect, then fabrication of the wax mold, then designing the scaffold, then we have to guide the tissue and healing process. Scaffold, I told you, know what is scaffold? This is the scaffold. Uh, in normal person, it is extracellular matrix. Outside it's a scaffold. The hydrogels, all those kind of things, it's a scaffold. In through here, the cells has to grow. Okay, if there is any acidic environment, the cells won't grow. That is the problem. Okay, next, bioprinting. In this bioprinting, in this bioprinting, we can see endothelial lineage. Endothelial lineage. This endothelial lineage forms a double layer, then it ends up in forms an artery. So artery is formed with a branch to replace. Next, the 3D printing we want to use in regeneration of the defect, but again it's not that much successful. Moving on to the next department, endodontics. uh, in this department they want to study this root canal morphology, because if they know is there is any accessory canal anything, they want to remove the infected material and they want to fill it back. If they do it perfectly, again it won't reinfected, then patient won't come back with a problem. Okay, but if you miss any small canal, small accessory canal, any little bit also, it will end up in reinfection. Again patient will come back any problem, again we have to redo the root canal treatment itself. So they want to study the root canal morphology with 3D printer. Next, we'll see what and all we have to do with like CAD CAM or 3D printing. RPD will do with 3D printing. Rest everything like crown bridge, complete dentures, zirconia, glass ceramics, titanium abutments, ortho, everything we can do with CAD CAM. But zirconia and ceramics will do it only in CAD CAM. We are not doing in 3D printing. Okay, everything other things we can do it in additive technology. We'll see what are the advantages for this. I already told you the precision and reduction of the surgical time is the main advantage. See, if the why I'm again and again telling the surgical time is less means it's good for patient and good for doctor also. Why I'm saying is if the surgery time is less, if we are doing in GA, this is more important. Why? We are taking operation theater, we have to pay rent for that, and we are taking anesthesia. Okay, then we have to pay the anesthetist, then we have to pay the oxygen cylinder, all whatever we use in OT we have to pay, and OT assistant, all those kind of things we have to pay. If the surgical time is less, everything will be lesser for patient as well as for the doctor. So this will help for that. Okay, and the morphological outcome also it's good. And when we use microsurgical craniofacial reconstruction using a computer assisted fibula flap technique, it yielded significant shorter ischemia time compared with conventional technique. And anatomical model printing, it's very rapid, simple, inexpensive, and it gives detailed analysis of the patient anatomy and realistic simulation of surgical procedure and preoperative plate shaping. Can show surgical guide help. It will guide the bone cuts, drilling and positioning of the osteotomized bone segments, and in even implant surgeries. I'll tell you what is reconstructive surgery, um, what is orthodontic surgery, what is dental implant surgery. Reconstructive surgery means like if any patient meet with RTA, anything it's like gone. Okay, like um, any fracture or anything, we are going to reconstruct. That is reconstructive surgery. Orthodontic surgery means by birth itself, uh, we'll see upper jaw, lower jaw. You can relate, no? Upper jaw, lower jaw. If the upper jaw is inside, then the face will be dish face. Okay, it won't look good. Otherwise, if the lower jaw is really front, something like that, it won't look good. It will give aged look. Okay, in those kind of cases they'll correct, that is orthodontic surgery. Dental implant surgery, if there is any missing tooth, we'll do dental implant surgery. Okay, that is, we call it as dental implant surgery. uh, for all these surgeries, uh, if you are doing 3D printing, the computer science, definitely we have to master. We have, at least we have to take help. And printing all this kind of things, no, it takes several days to several weeks in some cases. In those cases, if you are treating any cancer, that too any fast growing cancer, and the section margin should always be re-evaluated before using the cutting guides. Why I am saying, if the tumor is fast growing, if you are taking the measurement maybe 15 days before, after 15 days, after 15 days you are doing the surgery means maybe it would have grown more. Okay, that time you can't rely on these cutting guides. So you have to check manually, you have to perform larger approaches, check and then do. Check and then do the conventional technique. You can't go behind this cutting guides. Okay, to avoid high morbidity. Again, I want to show this. It's like we are doing like a partially replacement. This is like osteosynthesis plate. The main advantage is precision, I already told you, and easy use, and predictable post-operative results, particular concerning symmetry. I told you, no, if there is any left side problem, we can mirror image the right side and we can do the left, we can replace. So that is like concerning symmetry. Designed to replace soft tissue losses. Okay. I already told you about the main advantage of 3D printed facial epiphysis. Like if there is any problem one side of the face, we can mirror image the other side. We can replace the same side. Okay. And if you are doing like this, the file will be saved and it will be given to the patient as well. We can keep it in the hospital also. So we can do it again. And main drawback is risk of exposure and infection. The other drawbacks, it's infrequent in the literature. Why? Because nowadays only this 3D printing is we are doing more. Uh, so we have to do more cases and more paper, more studies, more paperwork. Then only we can get more complication in the literature. So the complications are less infrequent in the literature. Okay. The main disadvantage is in Europe the regulatory limitations. Their ethical committee is very important. Here also nowadays it's they are giving more importance to ethical committee. But in India, the first problem is the cost, because the middle class people are more and lower middle class is there. So the cost is the main problem over here. The cost of the 3D printer is a problem. The cost of the software is the problem. If the software is free, the result is unpredictable and it's time consuming. And for the doctor, he has to understand the computer science. He has to uh, update himself and do everything according to the computer science. And the problem is high investment cost. If you are buying a 3D printer, then investment is more, no? So we have to think about it. And finishing a final product is time consuming and it requires skill. I already told you, if you are doing a zirconia crown or EMS block, the sintering we have, milling we have to do, sintering we have to do, because to get a high strength, the mechanical strength we have to get, no, for that. If you are doing stereolithography, it can be done only using light curable liquid polymers. and resins cannot be heat sterilized. That is the biggest problem. The take home message is finally 3D printed objects should not be considered to be tools for unskilled surgeons. Why I am precisely telling this? If your junior is doing a surgery, he can't rely only on this 3D things. You have to know the conventional techniques properly, and then you have to take up the cases. Otherwise, you should not take up the cases. Why I'm telling all this to you? Because you are supporting surgeons, you should know to whom you are supporting. You should know the surgeon is a um, well versed in surgery or not. If you are advising or doing things to a junior, you should inform him this case it will be like this, you should be prepared for this. Okay, because I already told you in cancer cases, like in fast growing cancer, it won't match with cutting guide. So we have to go up with the conventional surgical approach. Okay. In future, what we have to look after is high resolution we have to look after, and biocompatibility. Mechanical strength is very very important, the time and the cost, but this is not the least, but cost is also important. If it is affordable, then everybody will get the treatment, no? So we have to look after that. Basically it's all a teamwork. The doctor, the clinician, the cell biologist, that is the research people, and the mechanical engineer, everybody if works together, the center, the patient is happy. I think so. I'm a bit bored, you everybody. I just want to show you the picture. One lady is wearing the seat belt, and one person going in the bike with four people. They are breaking the rules. Why I'm showing this? If you break the rules, it will end up in RTA. If you end up in RTA, this 3D things, no, everything will be needed. So we can avoid everything. It's a simple awareness, okay? I told you, 70. It's a 70 picture. So I hope I will meet you in 70 printing workshop. Thank you so much. Thanks for patient listening. For further details, you can reach me out in my email ID. Thank you.
Thank you very much, ma'am. I hope it's an eye opener for many of us here. Um, I, I would like you to participants, please, if you have any questions, queries, ma'am. Queries will be. Will you be able to? If any queries is there, will you answer, ma'am? If any
Yes, sir.
queries, yeah.
Yes, sir.
Any queries from the participants, please kindly you can ask now. You can unmute and ask your queries from the participants, because it's a very important because dental prosthodontics is a very important field now, and definitely many will have few queries and questions in their mind, doubts lingering. Go ahead, if you have any queries, please. Participants. Mr. Vishnuvardhan, you can unmute and you can ask queries, sir.
Yes.
Yes.
Good morning, ma'am.
Good morning, sir.
Ma'am, when you talk about that additive manufacturing for dental applications, how about the material properties, ma'am? How we'll find the biocompatibility of that material, ma'am, actually?
Sir, we use the material after research only we are using. They'll all check it up and then only it will come to us.
No. That's fine, ma'am. Actually, first, initially, when we are doing research about that biocompatibility, everything is fine, ma'am. But when after the process, additive manufacturing process or anything is there, 3D printing process, whether the properties will get changed or not, number one. Otherwise, whether the biocompatibility will change or not, ma'am, actually.
Sir, I want to tell you this.
Mm.
Whatever we use for manhood, I mean, uh, for the patients, the first thing which is has to be put tick is biocompatibility. If it is biocompatible only, we have to use. However, it is good in what way also. If it is not biocompatible, we can't use, no.
No, that is fine, ma'am.
So
Actually,
the material,
mm.
if the material is biocompatible only, it will come into the play. Otherwise, it won't enter.
Yes, I understood this concept, ma'am. But what I'm asking, after the process, whether the properties will get changed or not, that is my clarification, ma'am. Actually,
It should not change.
okay. Thank you, ma'am.
Huh.
Any other questions? You can even post the questions in the chat also. Just looking into that. Or participants, you can ask questions.
Sir, I want to elaborate little bit for Vishnu, sir.
Yes, kindly, ma'am.
Yeah. In some persons, we'll take example as titanium. Uh, Usually, titanium will go for everybody, but some
Mm. Yes,
person,
ma'am.
titanium allergy will be there.
Mm.
In that person, it won't be biocompatible, but we won't be knowing who is having titanium allergy.
Mm.
Nowadays we are checking and then we are placing, but
Mm.
before and all, after placing only we'll be know it won't, it's not working, then we'll change. Okay, in those
Mm.
cases it won't fit, it will come out of the socket itself.
Mm.
Okay, it will result in infection. Okay, I think so he
Okay.
want to know one that only, if I'm not wrong.
Yes, yes, correct. Yeah. Thank you,
Yeah,
ma'am.
yeah, welcome, sir.
We have Miss Anita. Anita, yes. Ma'am, you can unmute and ask your question. Anita, yes. You can ask your question, ma'am. Miss Anita, yes. There are two Anita S is there. The one who has raised her hand, you can ask your question. Hello. Okay. Think, ma'am, I do have a small question, ma'am. If
Yeah, please sir, please sir.
is normally this the replacement is taken is as a last resort, madam. Normally, is done as a last resort, or I
What
think
for,
if
sir?
for this, say for example, that jaw replacement, madam, you have highlighted in your presentation, ma'am. The
Yes sir.
jaw and that the teeth, that the crown part and other things, madam. Like normally, like as the, because there are many, especially like costs or some factors are there, no, madam. Costs in 3D printing is very much involved here.
Yes sir, yes sir, definitely.
So.
Sir,
Mm,
I want to tell you,
mm,
um, it's like, if there is any problem in the bone,
Yes,
I
ma'am.
mean, if there is any RTA or the zygoma bone or cheekbone or there's a mandible or maxilla, if there is any problem, definitely we have to treat. Definitely we have to replace. Otherwise, the patient can't eat properly and swallow properly and inhale properly. All those things are problematic. No. So definitely we have to replace. Yes, sir.
Okay, ma'am. Fine, ma'am.
And regarding the teeth, uh, teeth also, strictly speaking, we have to replace. But cost, because of cost, you can replace like uh, complete denture, which is removable. We can replace for the cost effective things. If the patient is affordable, we can do like implant supported denture, something like that we can replace. So it all depends upon the scenario, how the patient is coming to us.
Also, madam, it should be bio-friendly as usual.
Yeah, yeah, that is the first
Main thing,
important
first.
point, sir.
Yes,
First point.
thank you, madam.
Welcome, sir.
Think I think there are far more no many questions there. If you have any questions, you can even note down. You can mail it to ma'am at Dr. Renuga 2010 at gmail.com. If you have any other questions, you can interact with her through email. So, with this, I would like to thank Dr. Renuka Devi, madam, for taking time out from her busy schedule to give a presentation on 3D printing, especially in the field of the field of dentistry. Ma'am, it was a very good session and very informative session, and rather an eye-opening session for many of us.
Thank you, sir.
So, with this, we like to come to an we like to the feedback link is there. Feedback, please kindly. Sir, anyone wants to give any feedback in the chat, the online feedback? You can tell. Any feedback if you want to share?
Yeah, okay.
Uh,
Thank you, ma'am. Thank you very much giving such a good knowledge regarding the 3D printing in medical implant. And I would like to appreciate to all participant program trainer who delivering the knowledge from last 5 days. Really, I am grateful to be here. I learn a lot 3D printing and manufacturing, additive manufacturing. And especially I would like to thanks Dr. K.R. Kumar sir and team and Dr.M.G.R. University for organizing a great program. Thank you. Thank you very much, madam.
Thank you, sir.
now I request Dr. K.R. Vijay Kumar sir to give summarize the entire program and give a vote of thanks. Sir.
Okay. So, good morning, one and all present here. Gives me immense pleasure to deliver vote of thanks for the last 5 days online FDP on latest trend in additive manufacturing. On behalf of Department of Mechanical Engineering, I'm proud to extend my sincere thanks to Engineer A.C.S. Arun Kumar, President, for his constant support and encouragement to conduct such events. I would like to acknowledge our gratitude to Register Dr. C.P. Palnivel for his constant encouragement and support. I also extend my sincere thanks to Dr. Renuka Devi for her today's special lecture. I express my sincere thanks to our HOD, Dr. K. Rajan, for his constant support and encouragement to conduct this such events. So I express my warm gratitude to all my colleagues, particularly Dr. J. Jayasiran and Dr. K. Sri Krishnan for their continuous support to make this event grand success. Not last but not least, I thank all the participants for making this occasion a grand success. Thank you.
Thank you, sir. With this, we wind up today's session. Thank you very much.